largely in part due to schools ignoring the crisis. Mental health is a rising concern for adolescents and individuals of all ages. After extensive research and reflection on our own experiences as students, we have devised a plan for schools to work towards spreading awareness and promoting mental health. Schools should provide mental health resources to spread awareness and support good mental health for their students. In order to understand how schools can improve their students' mental well-being, one must first understand the severity of the crisis itself. Mental health in schools has been a problem for decades, but in recent years it has taken a significant decline. Although the recent COVID-19 pandemic has had a significant impact, it is not wholly responsible for these statistics. Some mental disorders on the rise are anxiety, depression, obsessive-compulsive disorder, or OCD, and of course, many more. In the BMC Public Health Journal, analyst Naveed claims about 50% of these mental disorders have an onset before age 15 and 75% by 25 years of age, contributing to lower testing and decreased comprehension rates. For years, researchers and activists have been trying to determine the cause of the decline in mental health and who is responsible for addressing it. A survey done by one activist says that most teachers believe school educational professionals and school health and behavioral health staff, including school psychologists, should be responsible for monitoring students' mental health. Only one teacher who participated in the survey believed that community health and behavioral health providers should be responsible for students' mental health and well-being. The source's next survey question asked how satisfied teachers were with their school's mental health resources on a scale of 1 to 10. 10 being highly satisfied and 1 being highly dissatisfied. Roughly 50% of the teachers who responded rated their respective schools' resources as less than 5. The surveyed teachers suggested increasing the availability of mental health counseling services, improving coping mental health literacy, and training in how to talk about mental health as ways schools can address their students' mental well-being. In an article about New Jersey teachers' perceptions about mental health services offered during the pandemic, Campbell writes, schools are also opportune settings for children who lack safety and support at home to recover from stress and build resilience. Therefore, we believe schools should be required to provide resources and support for students regarding mental health. Mental disorders among young people are increasingly recognized as critical to overall well-being and academic success, making it essential that schools take immediate action to address these concerns. Schools should offer resources that raise awareness about mental health and promote coping strategies and reduce stigma. Also, teachers should be educated on recognizing the early signs of mental health disorders such as anxiety and depression.
As the decline of mental health in students is increasing, there are actions to be taken to override the continuance of damage being done. Though some schools have small ways to address mental health, these ways are not proactive or effective generally. By embedding mental health awareness into school culture, educators can create safe and supportive environments where students can feel seen, heard, and valued. This shift not only enhances student emotional resilience, but also improves their ability to engage in learning. Many students continue to suffer in silence without access to proper resources or support. Schools must implement structured, long-term mental health programs that focus on prevention, early intervention, and ongoing care. A quote from an article in the Discover Mental Health Study from 2017 says, understanding the importance of school-based mental health initiatives can lead to better student support systems. Current statistics reveal a growing concern with millions of students experiencing mental health challenges. One step of action that can be taken to address this uprising is to get a group of teachers and offer in-depth training. This training will inform teachers on symptoms of different mental health problems and the best way to address them. Most of the research on these leadership preparation and professional development programs has understandably focused on providing the necessary skills and competencies for leaders to have meaningful impact on student learning and academic outcomes. From here, this team should collect statistics on the problem throughout their grade and school. They can use polls and Google Forms to get these statistics and data. These can be anonymous so the student doesn't feel threatened while providing the information for the team. After this data is collected, the team can get their can get together to brainstorm ideas on how to promote good mental health. From that, the team should take action on getting out and reaching the student body, making the intentional effort to spot mental health red flags and address them properly. A way of being intentional is by making quarterly checkups with each student in the school, assisting the counselor in their endeavor to reach the whole student body. A quote from A Trauma-Informed Approach to School Mental Health Workforce Development says, "Over the years, MHL has been reconceptualized and now incorporates concepts such as help-seeking attitudes, knowledge of mental health resources, proactive maintenance of good mental health, and awareness of stigmatizing attitudes and beliefs." As mental health challenges among students rise, school administrators need to equip teachers and staff with skills to effectively address these issues. Regular check-ins in collaboration with counselors can create ongoing support and reduce stigma, ensuring that mental health is prioritized. When leadership training has traditionally focused on academic outcomes, it must also emphasize mental health by incorporating both academic and emotional support into leadership development. Schools can create an environment that fosters overall student well-being, improving both mental health and academic success. Long-term commitment to mental health initiatives will ensure sustainable change, positively impacting generations of students to come.
Mental health interventions need to be implemented, but there are realistic barriers like cost being too high, accessibility, stigma, and resistance to change. Mental health interventions, school-based interventions, therapy, or counseling need money for professionals, equipment, and infrastructure. Most rural towns have not been found to have affordable mental health services, and this generates gaps in access. Most communities, according to school-based mental health, shift in addressing mental health of Pakistani youth have too few mental health professionals to fill the demand. Insurance hurdles and waits discourage people from seeking care on a timely basis. Stigma and public resistance or social stigma/fear of judging inhibits most people from seeking help. Others believe that it is less necessary to pay for mental health programs than to pay for physical medicine or schooling. Mental illness is an increasing issue for teenagers and people of all ages. Although there is a strong evidence for mental health programs applying them on a large scale, which involves overcoming budget constraints, defects, and the workforce and resistance from the public. Findings and mental health disorders reported from and university. While there are certainly obstacles, the long-term crime rates, improved school performance, the long-term advantages of prioritizing mental health are reduced crime rates, improved school performance, and lower healthcare expenses, which unequivocally outweigh the obstacles of spending money on mental health. It is not only an ethical imperative, but also a practical one for a healthier world. So as we finish this up, we have to say that school mental health isn't an issue, it's an emergency that should be taken care of immediately. The increased rates of mental health in schools and illnesses in students is a situation that has been faced by the school. We've outlined how the absences of funds, the requirement for training, and the teachers, and the implementation barriers are all very important things and have to be overcome. First, we've set out the unsettling erosion of mental health, well-being, and how it impacts the student achievement. Second, we've offered solutions in the form of offering extensive teacher training and starting proactive mental health initiatives. Third, we've set out the obstacles such as expense, stigma, accessibility, and that schools will have to overcome the best rollout of these changes. Now we appeal to school administrators and educators to place mental health in the spotlight by allocating funding for training, developing programs, and addressing mental health at every level within the school system. By equipping staff with the ability to detect mental health issues early on and by demystifying them, we can begin to make some genuine inroads in helping students' overall health. Let us come together and prioritize mental health so that all students can succeed emotionally and academically.
Audience.
Hi, my name is Kaylee, and this is my audience.
My audience